Okay, so looking at the particular areas where some of these lymph nodes are concentrated. So here, again, we have the names, the technical medical names of those particular groups of lymph nodes, and then what actually that means as far as location and what their function is. So we have the axillary, the cervical, inguinal, and the mediastinal. So axillary is going to be the armpit area. This is going to, again, if you have a lot of swollen lymph nodes or lymph nodes that are just kind of weird, a lot of times they'll check this when they're checking for like breast cancer and things like that. And then we have the cervical ones that are in your neck. So when you go to the doctor and they kind of like look down your throat or something, and then the doctor puts the hands on your neck and is kind of feeling around. They're usually feeling for these cervical lymph nodes, and it'll let you know if there's an infection somewhere in that area. So if you have an upper respiratory infection, then those lymph nodes are going to be inflamed. We have inguinal lymph nodes. That's going to be the groin area. So again, anything wrong with the legs or the pelvis area, those will be inflamed. And then mediastinal is fancy term for chest area. So anything going on in the chest cavity. So tonsils, probably pretty familiar with tonsils. So it's going to be lymphatic tissue that's on either side of the throat. What you may not be familiar with is that you have 3 sets of tonsils. It's not just the 2 in the back of the throat that people are most familiar with. There's 2 other sets. So we have the palatine tonsils, which are ones you're not going to necessarily see. It's higher up in the throat. The pharyngeal tonsils or the adenoids are the ones that you will be familiar with. Those are the 2. If you open your mouth and look in a mirror, if you still have your tonsils, you're going to see those in the back of the throat on either side. And then you have linguinal tonsils, which are further back on the back side of the tongue. And I'll show you a picture of those in a second. So they have leukocytes in there, which again are white blood cells. They're going to act as a protection against pathogens that are coming in through the digestive or respiratory system, which makes sense that it would be in the throat. Because as you breathe in with your mouth or you breathe in with your nose, it's going to go back down your throat. And so the tonsils are going to catch anything coming that way. Or if you're eating something you're taking in through your mouth, this is going to help protect you from that. Sorry. Tonsils are not vital organs, which means that they can be removed, which is why a lot of people do have them removed, especially if you have a bunch of infections such as strep throat over and over and over again. You can definitely have them taken out and it's not going to hurt you at all. So let's look at the picture. So again, we have the nose and we have the mouth here. These are starting on your jaw and stuff. So this is your teeth. That's your tongue coming back here. So you have your nose, you breathe in stuff, and it comes down the back of your throat. And when it does, we have pharyngeal tonsils that are going to possibly catch stuff right back here. So if you have your mouth open, it's going to be this stuff on either side of the uvula. I'm not sure I've ever seen those before on anybody unless they are swollen. So I don't think if you're looking in a mirror, you're going to see these. You will see your uvula, but not those tonsils. So then we have the palatine tonsils. Those are the ones that are on either side of the throat there. Most of the time, they're going to be kind of tucked around the corner unless you have something going on upper respiratory wise. Then they may swell up and come out this way. Sometimes they will have them removed because the tonsils will actually swell so much that they're covering the throat completely, where somebody's not going to be able to breathe, so they will do an emergency tonsillectomy on those patients. Then we have the lingual one, which is at the back of the tongue. So if you really stick out your tongue very far and open up your mouth, you can kind of see those. Your tongue gets bumpier as it goes back, and it's the really bumpy stuff at the very back of your tongue. I'm sure everybody's going to go home and look at that now. All right, so spleen is another part of the lymphatic system. So this is in the upper left quadrant of the abdomen. So up underneath your ribs on the left side is where your spleen is going to be located. It's got a lot of lymphatic tissue in it as well, and it has a lot of blood vessels in there. And we'll talk about how that's going to affect things. So it filters and destroys old red blood cells. Remember, red blood cells only have 120-day life. So once it's getting closer to that mark, the spleen is going to take the old ones out. But before it does, it is going to take the iron out of the red blood cells to recycle it, which is nice. So you're not having to ingest even more iron than you already have to. And then it's going to store up some blood supply for the body. So if you're ever in a traumatic event where you're in a car accident and you start bleeding or something, your spleen does have a little bit of a blood supply to kind of back you up, but spleen's not that big, so I wouldn't suggest just cutting something open really big and hoping that the spleen's going to help you out. So the spleen does have a lot of macrophages, which was one of our white blood cells. These guys are kind of our first line defense of white blood cells, and they're just going to eat up anything that's not part of you. Okay, so it's going to take out those pathogens. The spleen is also not a vital organ. It can be removed, and it's okay. You're going to live. It does make you more susceptible to bloodstream infections, though. So if you never have a infection in your blood, then you're fine. But if you do, then you may not have. You may have a harder time kind of getting over that if you don't have a spleen. So again, spleen is here, upper left-hand quadrant. So you have your stomach kind of in the middle. Spleen's kind of tucked up behind it. Kind of a bean-looking shape organ, but it's pretty much just a sack of blood. And it's got the white blood cells in there that's going to help protect us. Then we have the thymus gland. So this is upper portion of the mediastinum, which mediastinum is just your chest area. So looking like behind your sternum, the upper portion kind of right underneath where your neck is. So it is essential for developing of your immune system. It's going to develop different antibodies, and we'll talk more about that. So the hormone that it secretes is called thymosin, and it's going to change lymphocytes, which are one of our white blood cells, into what we call T lymphocytes, which makes sense because the hormone is thymosin and the gland is the thymus. So it makes sense that these two go together, and that when this hormone acts on the lymphocytes, that it's called a T lymphocyte, or it's called T cells, either way. So this is going to play an important role in our immune system. So it does, the gland is working even before you're born, and it's going to be working up a storm throughout childhood until you get to about the age of adolescence, so 15, 16, somewhere around in there, and your thymus gland actually begins to shrink. So it's the biggest when you're born, and it shrinks over time, which kind of makes sense because an unborn child has not been exposed to any sort of disease at this point. Not until they come out and are exposed to different nasty stuff that's around. So it makes sense that as they get